Welcome to Adapting Class. This is part 3 for the NCLEX review test prep test taking strategy. Like you said, there's no difficult question. There's no question that is ambiguity in it. It's just straightforward questions, but you have to figure out what the examiner is trying to ask you. So let's try it. So round 3, let's get to it. Straightforward question, as you can see. It's nothing I'm trying to trick you. It's long question, but you have to make it easy. What is the question? Which of the following the next you would anticipate? Which of this will you anticipate? The nurse is caring for a client admitted for what? Asthma exacerbation. That's a buzzword. After several administration of what? Albuterol. An inhaled steroid, client continued to have intercostal muscle retraction and shortness of breath. Which of the following the next you anticipate? Rewrite this 5-line question. I have asthma patient who came in with what? Exacerbation. Receive appropriate treatment, albuterol and steroid, inhaled steroid, but still having what? Intercostal muscle retraction and shortness of breath. These are your buzzwords. It tells you patient is still sick, no matter what you're doing. So what is the question? Rewrite it in your own word. Asthma patient not responding to therapy. What is the name for it? Status asthmaticus. That's all. Do you know how to manage a patient in status asthmaticus? That means what you're doing, you need to do more than what you were doing before. Asthmaticus need aggressive therapy, otherwise the airway is going to collapse. You see, so straightforward. You see, I spent time trying to figure out, convert all these 5 questions into one. Patient is in status asthmaticus. What is your management? Give them the big guns. Magnesium sulfate is another way of treating asthma patient if all you've done has failed. It relaxes smooth muscle. Remember, even if you don't know what it does, think about when somebody is in labor, right? Preterm labor, what do we give them? We give them magnesium to slow things down. So magnesium slow things down. Same thing if somebody is in pre-eclampsia and they're going to have seizures, we give them what? Magnesium. That is the function of magnesium in asthma patients. So magnesium sulfate is indicated. I'm just using the concept asthmaticus. You go back to asthmaticus. What are you doing? Giving them Samitrol. Think about it. I give them albuterol. It's not helping. Why would I give them Samitrol? Another reason, this is a long acting. You never use a long acting in asthma patient who is in acute distress. So this is wrong. Third one, IV steroid. If I give you inhaled steroid, it does not work. Well, to use the bigger gun, you give them what? IV steroid. You see, I'm just basing on what the question is asking and changing it. But this is select or apply. You don't have to pick all of them. I'm just picking it because it makes sense. Critical thinking. If you're an status asthmaticus and you getting sick, you're having intercostal muscle retraction, you have shortness of breath, you have impending doom of dying from the asthma, airway problem. I'm preparing for intubation. Is it a bad thing? No, it's a good thing. Status asthmaticus, who is suffering from asthma, is going to have airway collapse. Ibuprofen. This is a classic example. The board will trap you. You just want to know whether you understand asthma concepts. NSAID is a bad thing for asthma patient. Never give asthma patient NSAID. It exacerbates their condition. It creates nasal polyp. I intentionally put there to trap you. They are not in pain. If you pick ibuprofen, you kill this patient. Therefore, it's not indicated. How about IV fluid? Somebody will say patient is having airway, therefore we should not give them IV fluid. No, they're very dehydrated in this situation. They should get some fluid to help with that. Straightforward question and key answers are over there. Magnesium, IV steroid, prepare for intubation, and give them IV fluid. If you get a concept, it's not a hard question. I'm just teaching you how to answer questions and then master it for your exams. Okay? So that's number one is clean. What do we have the next one? The next question is the same concept. And this is caring for a client with asthma exacerbation, eating the same topic. Which of the following findings the nurse should report to the healthcare provider after Albuterol administration? Once again, asthma exacerbation is your keyword, which is your buzzword. And what you do, you give them Albuterol exacerbation. This change from asthma exacerbation initially as the keyword, and the best keyword is what? Albuterol. This is now my buzzword. If I'm going to answer every question, it's based on Albuterol. If you have asthma, I treat you with Albuterol. What should I see? It's a bronchodilator. It will make your symptoms better. But then think about the side effect of the medication. It's a bronchodilator. It's a beta agonist too. A beta agonist will speed things up. You're going to have tremor. I expect that. I don't need to report it to the ACP. You're going to have palpitation. I expect that. I don't need to report it to ACP. An asthma patient who stops wheezing is a problem. You're dying. Therefore, whether I give you Albuterol or I did not give you Albuterol, you will keep on wheezing. Every time you see an asthma patient and a wheezing, it's a good thing. That means air is passing through their airway. You see what I've done? I've answered the question without picking the right answer. I'm just using the concept. So tremor, palpitation, and wheezing are all unexpected findings in an asthma patient if you give them Albuterol. Therefore, which one is most dangerous? Sudden anxiety. All of a sudden, they're anxious. All of a sudden, you can't hear anything. Silent chest. All of a sudden, they're sweaty. All of a sudden, they don't want to lay flat. This patient is telling you impending doom. Sudden anxiety is airway problem. But even if you don't know, we're doing test taking strategy. Asthma patient, Albuterol. I expect you to behave certain way if I give you agonist. Beta agonist, tremor, palpitation. And this is classic for asthma. You're going to wheeze and you will never stop wheezing until you're doing okay. Therefore, what do you want to do? Number 4 is your right answer. You see how I approach it? This is the way I want you guys to approach your questions when you're doing a Q bank or anything like that. And then number 3, last one, is all concept. Select or apply. Which of the following diet the nurse should recommend? A nurse is caring for a client with what? Cystic fibrosis. One word, cystic fibrosis. What do you know about this? 2 things, lung issue and the pancreas. They have a lot of secretion, very thick one, and they get recurrent infection. The pancreas, no fat. They can't absorb any fat soluble, so they lack ADEK. Their stool is watery and voluminous. They have salt, chloride problem, so salt problem. You see, I've given you the content here. These people, they're in trouble. They cannot absorb anything. They're losing all their fat. They cannot take in salt. They have salt problem. Therefore, what diet do you think they need? It's a classic board question. Cystic fibrosis patient, if you see them, they look skinny. It's because of a lot of electrolytes, a lot of reabsorption problem. If you cannot absorb any calorie, especially fat, which has the highest calorie of all, what do you think? You need high calorie diet. They need a bunch of fat because they're losing everything in their stool. So this is wrong. High calorie diet should be high protein diet. Why do they need calcium? It's because of the pancreas. So give them a lot of milks. Food that has high calcium in it is what they need. And we already know they have a salt problem. Give them some crackers, salt stabs to help with the dehydration. So what the cystic fibrosis patient need is just a concept. These are like easy questions. I can set questions easily just using the concept, and that's what your board does. If you go to the Q bank, that's all they do too, right? So what is the problem? Cystic fibrosis, high fat diet, high protein diet, okay, high salt diet, and high calcium diet. 14 you should not forget. Otherwise, they will trap you. What are we doing? NCLEX prep, test taking strategy, how to answer questions. Good luck. Take care. Bye-bye.